Also, the pituitary gland will be on the middle as well. Fine. Your posterior fossa, again, we mentioned that. So you have anterolateral and posteromedial contents. It contains your brainstem and your cerebellum as well. What are the benign tumors of the posterior cranial fossa? It's usually ependymoma is the most common one, and acoustic neuroma, which is a schwannoma or a tumor of the Schwann cells of vestibulocochlear nerve. Lots of things to identify here. That's your base of the skull. This picture is very intimidating to lots of the students, but just take it easy. Let's break it down into simple things. So what is this? This is your base of the skull, but we added some structures in it, all right? So all of this is your tentorium covering the base of the skull. Starting from the front, that's anterior cranial fossa, very confidently. You have this is the cribriform plate. So of course, number 20 and 21 will be olfactory nerve. You're very confident about that because you all know, and I'm sure you all know, that olfactory nerve is related to the cribriform plate. All right. So moving here, you can see that there is some sort of a canal here, which we mentioned early. It was there, number 34, optic canal. So this has to be the optic nerve. The 24, optic nerve. 23, optic chiasm, because they meet in the middle. And 25, optic tract. There is an artery related to the optic nerve. This is your terminal part of the internal carotid artery. And we're coming to talk about it later in the session. Terminal part of internal carotid artery. The butterfly, number 16, is your midbrain. So how did you know that this is midbrain? Well, the way it looks like midbrain, that's one. The other thing is, doctor, I'm currently in supratentorial region. So I do not see the posterior cranial fossa. So this should be the brainstem. And the first part of the brainstem is your midbrain. Good. In front of the midbrain, you always have the basilar artery. So that will be the basilar artery. The basilar artery divides into two terminal branches. These are the posterior cerebral arteries. So number 27, it has to be the posterior cerebral artery. Oh, hold on. Posterior cerebral artery is connected to the anterior circulation by a very small artery.